life ultrasound for detection of cancer have demonstrated poor specificity. As such, within the current standard of care, ultrasound is used largely to guide biopsies rather than identify the location and extent of cancer. The use of MRI alone to detect the cancer has been evaluated in a limited fashion. On the other hand, MRI uses powerful magnetic field and radiofrequency pulses. And these powerful magnetic fields and radiofrequency pulses may be harmful. Besides, inclined medical devices may cause problems when during the exam. Its three-dimensional imaging is accomplished with the aid of computer tomography and X-ray scan. But X-rays poses some risks to be invasive also. The limitation of the imaging methods of prostate cancer motivate us to seek alternative technique for cancer diagnosis. The use of near-infrared optical methods for diagnosis and detection of cancer have generated considerable interest last years. Advantage of these optical methods are that they are non-invasive, fast, relatively inexpensive, impose no risk radiation, and the near light can easily penetrate thick biological tissues. Near transformation technology was used for breast cancer successfully. We think to apply this method to the prostate cancer. It is clear that near transformation imaging may actually work better for prostate than for breast, as the penetration depth between the infrared light source placed in the prostate section of urethra and the camera placed in the rectum is considered shorter than for breast. Important to be pointed that the new technology is not used as an imaging method for prostate cancer diagnosis yet. So, in our opinion, it is necessary to investigate the possibility of usage of this method for isolated prostates. Here is shown experiment setup. On the left picture, we see while arrows 1, 2, and 3, and 4 are shown LED, CCD camera, power supply, and computer spectrum. And on the right picture, we see the isolated prostate placed between the CCD camera and LED. This system is placed in darkness to avoid the artifact of visible light. Emitted from the LED infrared light, pass through the prostate and carries information about prostate tissue's unhomogeneity. Incident infrared light is converted into electrical signals by CCD camera and is transferred to the PC, like the human eye, where the incident visual light is converted to the electrical impulses, so-called action potentials, and transferred to corresponding brain tissues. Its came providing of our experiments in following. Firstly, a patient is diagnosed with standard methods, and if cancer is detected, radical prostatectomy is performed. Immediately after this operation, isolated prostate is examined in infrared light. The prostate infrared images are analyzed, and locations of cancerous organs are determined. After this, the prostate is investigated histopathologically, and the histopathological diagnosis is issued. The results of infrared examination are compared with histopathological examination. It's worth mentioning that the results of determination of cancerous organs with infrared methods precisely coincide with this detection with the histopathological methods. Here is shown infrared image of non-cancerous prostate, as it is seen from the rectum side. In the case, radical prostatectomy was performed after diagnosis of benign hyperplasia. It is easy noticeable that brightness is even almost area, and the homogeneity shown by the arrow belongs to the Petri dish. In contrast, infrared light on cancerous prostate glands is characterized with extremely non-homogeneity. This is so because cancerous tissue optical density is much higher than the optical density of non-cancerous tissue. Here shown one of the prostate cancer infrared image. This is view from the rectum side also. The dark area located upper right half of the picture shown by the organ corresponds to cancerous outgrowth. After this near investigation, this prostate gland was examined histopathologically, and following standard methods in this case, the Gleason score was shown was 8. To compare the transillumination images of non-cancerous tissues with cancerous ones, we have elaborated software, it's a computer program. The principle is program divides a brightness of near transillumination image into 256 degrees. Consequently, the number 255 corresponds to the absolutely light image. On the contrary, 0 corresponds to absolutely dark image. This software gives different codes to healthy and malignant areas. If it separately calculates the average values of their brightnesses and calculates their ratio, obtained number is stored in the memory. Such calculations are provided for all next experiments, so we can obtain consequence of these ratios. The number of experiments with statistically reliable value, at least 30 experiments. The program calculates so-called 95% confidence interval. In our case, after the examination of 41 cancerous prostates, we obtained the interval of these above mentioned ratios in this interval shown. Thereafter, if new unknown prostate near transillumination image will analyzed, software will calculate above mentioned ratio again. Finally, software will compare this new meaning with that interval. If the barely measured number occurs in this 95% interval, we can declare with 95% probability that this new prostate is cancerous. Besides, the relative software enables to map out distribution of prostate cancer in different aggressiveness in color expression. Here is demonstrated part of prostate gland in grayscale, left one, and in color representation. In the grayscale picture, less aggressive area is indicated by arrow 1, and cancerous outgrowths with highest aggressiveness are indicated with arrows 2 and 3. In colored part, the less aggressiveness is shown in red, arrow 1, and cancer with higher aggressiveness are shown in blue, arrows 2 and 3. Right inside the color bar. Now you see words about the polarized light used in this method. A light wave, electrical field vector, vibrates in all perpendicular planes with respect to the direction of propagation. Here we see this. If the electrical field vector is restricted to a single plane by filtration, light is said to be polarized with respect to the direction of propagation. This and that is already the polarized light. In this schema, which you see, polarizers 1 and 2, or polarizer and analyzer, represents filter. Orientation of analyzer determines passing of polarized light through it. In the case shown here, polarized beam will not pass through the analyzer. If analyzer is oriented parallel to polarizer, polarized light will pass through it. If optical isomers will place on the path of polarized beam, the electrical vector polarizer angle will be shifted. Consequently, corresponding rotation of polarizer 2 causes passing light through it. Thus, placement of optical isomers on the path of the incident plane polarized beam causes turn of the vector. So, this is non-polarized light, already polarized light, isomers, which turns the vector, that gives opportunity light to pass. Prostate tissue behaves like isomers and causes turn of E vector. The experiment setup is shown here. This is polarizer and upper is analyzer. Here you see polarizer and analyzer, and between them is prostate. On the left figure is shown infrared view cancerous prostate obtained in non-polarized light. On the right figure is shown image of the same prostate in the polarized infrared light. This is easy notes about that polarized light gives opportunity to detect much more details and additional cancerous odors which were not detected in non-polarized light. On the basis of our investigations, we have developed it and fabricated prototype of future device for prostate cancer diagnosis already in vivo. Device consists from infrared illuminator in the upper picture, which will be placed in the prostate through the urethral channel, and from the infrared detector, which will be placed in the rectum. The detector is connected to computer. Elaborated software forms prostate infrared images and determines existence of cancer with 95% of probability. Here shows detector with isolated prostate, and we see the cancerous cell groups detected by now new device. Cancerous areas are shown by arrows. Finally, in our opinion, the method is promising. We are continuing our investigation. Thank you for your attention.
Any question or comment?
Well, early diagnosis of prostate cancer is really an active theme in urology, because we know that about 20 or 30% of the patients on which are performed radical prostatectomies are overtreated, and all investigation in this field are very interesting. Of course, this is also one new method, and we can expect in the future some interesting results of this method. Perhaps what I think is that in the future we should combine several methods in early diagnosis of prostate cancer. For example, liquid biopsy has risen significantly in the last 10 years, and also nuclear magnetic resonance in early detecting, and perhaps in the future we shall have one diagnostic method more.
Any question or comment? Okay, thank you so much.
Thank you.